So my name is Stefan Verheye. I'm an interventional cardiologist from the Antwerp Cardiovascular Center, Middelheim Hospital in Antwerp, Belgium, and I'm presenting the Bioadaptor Dynamics study, the clinical and angiographic endpoints at 12 months on behalf of my co-investigators. Well, the rationale basically is based on the fact that the event rates currently with the DS that we have is still high and remains high beyond year one. We should not forget that at 5 years, the event rate, or the TLF, basically at 5 years is somewhere between 7 to 10% with the current DS. And if we look at a longer period of time, like 10 years of time, then also the event rate remains very high, somewhere between the MACE rate, somewhere between 40 to 55%. So that's the reason basically why this study was done. That's two questions. First of all, the DynamX Bioadaptor is a very interesting platform because it behaves acutely like a normal DES, like one that is being used in the cath lab on a daily basis, with the same acute characteristics in terms of deliverability, flexibility, radial force, etc. So this is good, but then later on, when the uncaging elements or disengage, then basically the bioadaptor responds to the process of atherosclerosis. In other words, you have the phenomenon that when the vessel grows, also the platform can grow with the vessel. So there is an adaptive remodeling in response to the vessel beyond 6 months. So that's a unique feature of this particular device, having the uncaging elements and allowing the bioadaptor to grow over time with the vessel. And this is a very important feature. Now, the study itself was performed. It was at 7 international sites, and we analyzed 50 patients with single de novo lesions. And we had several endpoints. The clinical endpoints was target lesion failure at 9 to 12 months. And then we had also the looking at QCA, late lumen loss, the MLD. And then, of course, also on IVUS, we looked at change in medium and mean minimal luminal area. We looked at the changes in bioadaptor vessel area. And we also looked at pulsatility. And finally, we also did OCT to look at neointimal hyperplasia and strut, position of the strut to the vessel wall. So the findings were, first of all, the clinical findings, the essential results were that there was no target vessel revascularization through 12 months. So basically, the TLF rate was 0 until 6 months. We had 2 patients who died at the time period of 12 months, and that was one of patients suffered a Korsakoff, who was also a Korsakoff syndrome, and who was found dead. And then another patient was hospitalized due to heart failure and was also adjudicated per ARC2 as a cardiac death due to heart failure hospitalization. So the initial or the clinical results were actually very good. Now, in terms of angiography or the angiographic findings, is that there was an acute performance which was excellent. The acute gain of the bioadaptor was 1.63, which is very similar to what you see in current DES. And then in terms of late loss in the bioadaptor mean was 0.12, which is also very similar to what you see in current DES. Now, in terms of IVUS, the interesting finding was that we did notice an increase of around 3% in the mean vessel area and of about 5% in the mean bioadapter area, while the lumen area remained unchanged. And so basically this is typically what we call a positive adaptive remodeling to maintain the lumen area. So those were basically in a nutshell the essential results of the study. Well, like I said at the beginning, the acute performance is basically very similar to current DES, to any workhorse DES that is now available. The only and main difference of this technology compared to DES is the fact that there are uncaging elements. And these uncaging elements, they disengage at 6 months, which allow the bioadapter to adapt to the response of neoatherosclerosis, or to the responses, apologize, of atherosclerosis. And this is the main differentiator to the DES technology that we know today. Well, the take-home message here of this particular finding is that, one, this bioadapter performs acutely just like any current DES device. Second, we have seen that there are uncaging elements that allow for positive adaptive remodeling beyond 6 months after implantation, that we do see cyclic pulsatility within the bioadapter, and that we also see return towards vessel angulation. And all of this may be associated with lower TLF and restoration of better blood flow.